Um, it's really good to be here. I'm happy to have the opportunity to present our work to you. This is work done by my student, Hanit Bar-Yehuda, and myself at the Hebrew University in Jerusalem, supported by the Levine Center for Child and Adolescent Psychology and the March of Dimes, the U.S. Science Foundation. It is well known by now that subclinical autistic characteristics are seen in members of probands with autism. This has been referred to as a broad autism phenotype, shortly termed the BAP, which, to my surprise, I have to say, has been rather little discussed in the conference. Debated potential characteristics of the BAP and of the autism phenotype, and that we've heard about quite a lot, are language deficits. And the question is, are those part of the BAP, or shall we talk about comorbidity of language deficits and autism? And I think what we heard earlier this morning about the DSM-5 rather points to the second alternative, namely language deficit as separate from the autism phenotype. So the current study was set up to investigate the status of language within the BAP. Now let me point out that there is a real, I don't know whether I should call this ambiguity, or rather a different way of using language depending on who the crowd is. So within psychological and clinical quarters, when we talk about language, we really talk about a rather broad sense of language. And that is closely related to communication, to conceptual understanding, to social understanding. Language is a communicative tool. However, when you talk about language within linguistic quarters, you really refer to a very specific component of this extremely broad notion, namely the formal properties of the linguistic system. Now, if we would like to dissociate language from conceptual and social understanding, our only hope is if we go to these very formal properties, mainly inherent in grammar and in morphology, and study those. Otherwise, we get completely entangled, and it's going to be very difficult, in fact, I think impossible, to dissociate language from social understanding, communication, and conceptual development. So with this in mind, I'll present the study. So within ASD, the linguistically most compromised group are nonverbal children with autism. They are estimated at 25 to 40%, with figures depending largely on the definition of nonverbal. Now, the most common definition of nonverbal is listed below here, and this has been adopted by most studies when they refer to nonverbal. These are children who have vocalizations and no words or very few words and don't combine words and don't, in any case, don't know anything that is above 5 lexical items. The hypothesis was the following. If there's a familiar basis to language deficits in autism, that is, if language deficits are part of the broad autism phenotype, then you would expect that siblings of nonverbal probands will be most vulnerable and will most likely show deficits in language measures. The study therefore compared siblings of nonverbal children with autism, SIBS A and V, to typically developing siblings of typically developing children who are themselves typically developing, matched on all the relevant parameters. Now, let me point out that we did not compare the children to any other siblings of any other pathological groups because we didn't want the pathology to interfere. We wanted to see whether the siblings of these children are going to have normal language as expected by their age group. Now, prior to any group comparison, it was ascertained that there were no statistical differences between siblings who were older than the autistic proband or younger than the autistic proband, and there were no differences between brothers and sisters of the autistic kid, and those kids were males exclusively. So here's some of the demographics. The groups were compared on age, of course, on age of the mother, age of the father, level of education of the mother, number of rooms in the apartment, number of children in the families, just any measure you can think of. And intelligence was investigated through the various Wechsler tests, either the WIPC for the preschoolers or the WISC-R for the school-age children. Language was ascertained on the self, P for the preschoolers, or the self-3 for the school-age children, on the Benton naming test to test vocabulary, as well as analysis of spontaneous speech that the children produced. Here are the results. Significant differences were seen between siblings of nonverbal children with autism and siblings of typically developing children on all the intelligence measures, so on verbal, performance, and full-scale IQ. The siblings also performed worse, lower on the self, receptive, expressive, and total language scales. Performance under Benton, that is a lexical, measures of lexical knowledge, did not differ among the groups. Here are some of the results. As you can see, all significant differences are stated in bold. On most subtests, the groups differ. With respect to the clinical status, we looked at whether children were below one standard deviation of the norm, assuming that being below one standard deviation or 1.25 standard deviations will place them at some clinical considerations. So no child in the typically developing group was below one standard deviation, whereas 8 children were below the receptive scale, 9 children were below the expressive scale, 7 children were below the total language scales of the siblings of the autistic kids. So these kids are likely to be referred for clinical considerations. As for intelligence, no child from the typically developing group was below one standard deviations, whereas you had 2, 4, 3 children who were below one standard deviation with respect to intelligence, so children of low intelligence. However,